This next section is on the conducting system of the heart. It begins with the SA node or sinoatrial node. It is in the posterior wall of the right atrium, and this is where each heartbeat begins. The action potential is generated in the SA node. It's our own private personal pacemaker. And so the action potential begins there, and then it's going to spread throughout the atria. The internodal pathways are formed by conducting cells. Now these cells are not nervous cells, but rather just muscle cells that will conduct electrical signals. And the internodal pathways distribute the signal through both atria. The signal arrives at the AV node, and this is at the junction between the atria and the ventricles. And it will relay signals from the atria to the ventricles. This area, the AV node, is kind of like the backup for the pacemaker. So it can take over if the SA node fails. The SA node beats at, it was 60 to 100 beats per minute, whereas the AV node is slower, 40 to 60 beats per minute. From there, the signal goes to the AV bundle, which is down the interventricular septum. From the AV bundle, it goes to the bundle branches. There's a right and left branch, and this is going to transmit the signal to the apex of the heart, and from the apex of the heart, it's going to spread out in the ventricular walls, and that is by way of those Purkinje fibers. So with the Purkinje fibers, it radiates upward through the ventricular walls, and it's quite fast. This action potential is going to stimulate the ventricular myocardium and trigger contraction of the heart. So here are the components in the correct order: SA node, internodal pathways, AV node, AV bundle, bundle branches, and Purkinje fibers. So the cardiac conduction system's coordination of the cardiac cycle. So the action potential is generated at the SA node, and atrial activation begins. The stimulus spreads across the atrial surfaces to the AV node. At the AV node, there is a delay, and during this delay, atrial contraction occurs. On the ECG tracing, that is the P wave, is the atrial depolarization. The P wave is the atrial depolarization, and the PR interval is the is conduction through the AV node and the AV bundle. The impulse travels along the interventricular septum, along the bundle branches to the Purkinje fibers, and ventricular contraction will begin. The QRS complex is the ventricular depolarization. And this relates each section of that conducting system with the ECG signal.
Welcome to another Anatomy and Physiology Smart Art video, where we guide you through an important piece of art. After watching this video, you should be able to describe the conducting system of the heart and the electrical events shown on an electrocardiogram. Let's begin by looking at this image showing the heart and its conducting system, a network of pacemaker cells and conducting cells. An electrocardiogram, or ECG, also known as EKG, measures the electrical activity of the conducting system. Let's move to step 1. Each heartbeat begins with an action potential generated by the sinoatrial, or SA node. The SA node is a cluster of pacemaker cells embedded in the posterior wall of the right atrium. Step 2, the action potential travels along the conducting cells of the internodal pathways and spreads across both atria. We see this depolarization of the atria as the P wave on an ECG. Step 3, the action potential continues to the pacemaker cells of the atrioventricular or AV node, located at the junction between the atria and the ventricle, and to be seen as the PR segment. At this time, atrial contraction actually occurs. Now let's move to step 4. As atrial contraction completes, the impulse moves along the interventricular septum within the conducting cells of the AV bundle, the right and left bundle branches of the Purkinje fibers, as well as the moderator band and the papillary muscles of the right ventricle. In step 5, the Purkinje fibers distribute the impulse throughout the ventricular myocardium, causing the ventricle to contract. We can see this ventricular depolarization on an ECG as the QRS complex. Ventricular contraction, however, begins shortly after the peak of the R wave. The atria are repolarizing at this time, but the repolarization is masked by the QRS complex. To summarize, the heart's conducting system consists of the pacemaker cells of the SA and AV nodes and conducting cells of the internodal pathways, AV bundle, bundle branches, and Purkinje fibers. The electrical events of the conducting system can be seen on an electrocardiogram, with the P wave representing atrial depolarization and the QRS complex corresponding to ventricular depolarization. Remember that the atria actually contract during the PR segment, the ventricles contract shortly after the R wave peak, and the QRS complex masks atrial repolarization. Notice in this ECG tracing the T wave, which represents ventricular repolarization. So what? Why is it important to understand the heart's conducting system and the electrocardiogram? Well, this knowledge is crucial to detecting and diagnosing cardiac arrhythmias, abnormal patterns of the heart's electrical activity. Cardiac arrhythmias can be caused by drugs and hormones, a heart attack, or for unknown reasons, and can range from temporary and relatively mild conditions, such as premature contractions of the atria or ventricles, to life-threatening, as in ventricular fibrillation, when the ventricles quiver and are unable to inject blood. Many other cardiac arrhythmias are possible, and treatments range from medications to the surgical implantation of an artificial pacemaker to regulate heart rate.
If cells of the SA node are killed, what part of the heart has the autorhythmicity to establish a new but slower heart rate? That would be the AV node. Which of the following is the correct pathway for the heart's conduction system? That would be SA node, AV node, bundle branches, Purkinje fibers. What part of the conduction system supplies the ventricular myocardium? That would be the Purkinje fibers. What structure is responsible for the 100 millisecond delay, allowing the ventricles time to fill? AV node. Normal and abnormal cardiac activity can be detected in an electrocardiogram. It is an ECG or EKG because cardio in German is spelled with a K, and it's a recording of the heart's electrical activities from the body surface. So it will assess performance of the conducting system and the contractile components, and you may see an abnormal ECG after a heart attack. And there's many different kinds of these ECGs. Some have 12 leads, some have fewer. But what you'll see in a normal pattern is this complex here that starts with P and goes to T. That's the PQRST. And P represents atrial depolarization. The atria begin contracting about 25 milliseconds after the P wave begins. The QRS complex is ventricular depolarization. It's larger because the ventricle is larger, and the ventricles actually begin contracting shortly after the R wave peak. And this large peak is not allowing us to see the repolarization of the atria. We do, however, see the repolarization of the ventricle with that T wave here. The PR interval is the period from the start of the atrial depolarization to the start of the ventricular depolarization. And 200 milliseconds may mean damage to conducting pathways or the AV node. So the length of that PR interval can indicate problems. The QT interval is the time for the ventricles to undergo a single cycle, and this can be lengthened by electrolyte disturbances, medication, conduction problems, coronary ischemia, which was lack of blood flow to the heart, and myocardial damage. So those lengths, it's not important to know that the different problems from the PR or the QT complex. Just realize that the length of those can indicate specific problems with the heart. At what point in the ECG does atrial repolarization take place? That's the QRS complex, and we can't see it because that's when the ventricle depolarizes. The ECG can show arrhythmias, an abnormal pattern. About 5% of healthy people experience a few abnormal heartbeats every day, and it's not a problem unless there's, a problem with the pumping efficiency of the heart. You do not need to know all of these different types of problems. We're going to explain them, and I'll give you a couple that you need to know. Premature atrial contractions occur in healthy people, and it may occur more with stress or caffeine or various drugs. Paroxysmal atrial tachycardia is premature atrial contraction that triggers a flurry of atrial activity, and the ventricles, the atria is contracting quickly. The ventricles are going to keep up and contract at the same pace, 180 beats per minute. Here we just need to know that tachycardia is a rapid heartbeat. Atrial fibrillation. So fibrillating is quivering. And in this case, the atria quiver. It's not an organized contraction. The ventricular, you can see that ventricular peak remains pretty normal. The ventricles fill passively up to about 70%. So the heart is beating and sending blood through the body, and the person may not realize there's a problem. Although the heart will still pump blood, the flow through the atria is sluggish. Due to this, people with AFib have an elevated risk of forming blood clots. Consequently, they're usually placed on a blood thinner to reduce their risk of heart attack, emboli, and stroke. Premature ventricular contraction. The Purkinje cell or ventricular myocardial cell depolarizes. We don't need to know this one. And drugs and hormones can change this. And ventricular tachycardia is more dangerous than atrial tachycardia. Remember, tachycardia is rapid heartbeat. And here's the bad guy, ventricular fibrillation. So fibrillation is that quivering, also known as VFib, and this is responsible for a heart attack or cardiac arrest. Because the ventricles are quivering, they are not pumping blood anymore. If you suspect that you have trouble with your heart, you'd go to a cardiologist, and they may put you on a Holter monitor for 24 to 48 hours. You just wear it at home, and they take a recording of your heartbeat over that period and can quickly go through the recording to see if you have had any irregular heartbeats during that time period.